enter the room.
Hello, I'm one of the doctors in the GP surgery. Can I confirm your name and date of birth, please?
Yes, my name is Damien Potter and I'm 45 years old.
Okay, how would you like me to call you today?
You can call me Damien.
Okay, Damien, nice to meet you. How can I help you today?
Doctor, I'm so worried right now. I think I have cancer again. I have this rash behind my neck. I'm so worried. I think it's cancer.
Oh, okay. Damien, I can see that you are clearly very worried and concerned about this. I'm so sorry to know that you're worried, but can we have a little chat so that we can understand what's going on?
Yes.
Can you? Yeah, sure. So can you explain a little bit more about this rash? And you mentioned you're having cancer again. And did you have any previous experience of the same matter?
So, doctor, I had this rash behind my neck for a few
Mm-hmm.
months now. I
Okay.
also have, it kind of hurts as well. Sometimes it's itchy. I have
Okay.
noticed some changes in the size as well. Previously, you asked that I had a lipoma on my lower
Okay.
back.
Mm-hmm.
So I went for a biopsy about a year back, and then the doctors told me that I don't have to worry, it's not cancerous. But I'm really
Okay.
not sure if they gave me a right diagnosis about it.
Okay, so thank you for sharing that information. I would like to ask a few questions about this rash. So you said you noticed the rash in the neck, and you said it's getting a little worse. What do you mean by that? Is it increasing in size, or are you having any new symptoms? Sorry.
So, doctor, I think that it seems that it has changed in size. It
Mm-hmm.
sometimes it hurts, and sometimes it's itchy, and I also think that I'm losing weight.
Okay. Can I know since when you felt like you losing weight?
I think just for like 2, 3 weeks for
Okay.
this past 2, 3 weeks, I think I've been losing weight. I'm
Uh,
really worried, doctor, because
uh,
I had a
mm,
friend who died of cancer
uh,
2 years back. It was so upsetting. I think that I do have cancer, doctor, because I
uh,
am facing similar symptoms like how my friend did.
okay, I'm really sorry to hear about your friend, and I can see where your worry is coming from, and it's truly understandable, Damien. Um, can I ask a bit about your weight loss? Have you measured your weight, or you just feel like it, or do you have any loose clothing or anything like that?
Doctor, I think I feel I've lost
Oh,
weight. I
mm-hmm.
did not check my weight though, but I do think
Okay.
that I might have lost
Okay.
weight.
Okay. Right. Okay, Damien. So for this rash, have you been to see the doctor before this? Have you been seeing a doctor for the same matter earlier as well?
Yes, I have been to multiple doctors.
Okay.
They keep on referring me to the specialist, but none of them have any clear answers. I'm
Uh,
definitely sure, doctor, there's something wrong. It is
right.
cancer, and I
Mhm.
need treatment, doctor.
Okay. Damien, what did you undergo any tests or any scans or anything during your previous visits?
No, I mean, yeah, they did do some testing and everything, and they kept
Uh-huh.
reassuring me that there's
Okay.
nothing wrong into it. But I know, doctor, there is something very sinister going on. I know it is
Okay.
cancer.
Right. Okay, Damien, I do understand. But I will discuss this with you. But before that, I will quickly have a background medical information check with you. Do you have any other medical problems other than this rash?
No, no,
Okay. And
doctor.
okay. And do you have um, any medications you're taking long term?
No, doctor.
Okay. And have you ever been diagnosed or treated for any mental health condition like anxiety
No,
or No, okay, right. And do you have anybody in the family having any mental health problems? Sorry.
No,
Okay. And what do you do for a living, Damien?
I work as a teacher.
Okay. And is this affecting your work and daily life?
Ye- Yes, yes,
Yeah.
it's significantly affecting my
Okay.
performance and my
Right.
attendance.
Okay, I'm really sorry about that. And may I ask about your mood? Are you feeling low and depressed during the past few weeks or months?
Yes, doctor, I am feeling pretty low.
Okay, and if I ask you to rate your mood from a scale of 1 to 10, 1 being the lowest and 10 being happy, where would you place your mood?
I would say 5.
Okay, and have you lost interest on things that you usually like doing?
Uh, not
Uh,
not entirely, but
uh,
yes, doctor, I'm just
uh,
very anxious all the
2 minutes
time.
remaining.
I'm worried.
okay,
I'm sure I think it's cancer.
okay. So, have you ever felt like harming yourself by any chance?
No,
Okay, Damien. So, can I have a look at your rash? I would like to observe your rash.
yes.
Okay. So Damien, I had a good look at the rash, and it just looks like a few scratch marks, but I can't see anything sinister or anything alarming. I know that you have been hearing that for a while now, and you might not like this, but the truth is you've undergone a lot of tests and seen a lot of doctors, and it looks like medically there's nothing to worry. But I know you're worried because I believe that you are being overly concerned about your health symptoms, and we call it a somatic symptom disorder. Um, and we have help. I mean, we can help you to get rid of this overthinking of your symptoms. How does that sound to you?
So what are you going to do for me, doctor, now?
So I would like to refer you to our talking therapies. So they will talk with you and help you how to cope up with these symptoms, thinking or overly thinking about your symptoms. And I would also like to refer you to the psychiatric clinic. So they will because you are having a low mood. It might be helpful. Sorry. Um, so that then they will also have a look and they will advise you on how to cope up with this, and it will um, doing more tests and starting on
Move on to the next station.
okay. Okay.
Good job, guys. Awesome. That was nice. Yeah, well, nicely diagnosed. So this is somatic symptom disorder. So, just a couple of questions that I'd like to ask you guys. So, what do you guys think? Like, what are the presentations for these, these kind of conditions? Like, what are the main questions that you need to ask? Because, Dr. Ragmal, even though you did a good job, you took about, you started the diagnosis at around 2 minutes. And that is like,
I know I took a lot of time for the data gathering. True.
yes. So let's break it down. Let's think about the most important things that need to be asked. So what do you guys think are some salient features, when it comes to such psychiatric disorders? Anybody wants to join in? All right. So basically, the main thing that you need to understand is the trigger. So there is usually a trigger that actually starts, for them to feel this way. One important thing is, have you ever felt this way before? Right? Like, is there anything that recently happened? So to understand that before state and their current state, like what was that, the point that actually made them be this way. So one thing that was mentioned was that her friend died 2 years back and she's feeling like she has the same symptoms. So these people, they don't have much insight, even though, you tell them they don't have a particular disorder, you do like a series of tests, they usually come out positive. I mean, they come out with no issues. and yet they feel so worried. So, they do a lot of research into all these conditions. So, they go for very frequent health checkups, and, they kind of have like different symptoms at different parts of their bodies, which might not even be related, right? So that's exactly what you need to understand. That was very good line of questioning where you went, have you had this before? Have you gotten any tests done? So apparently she had a lipoma and she got a biopsy. They said it wasn't cancer, but it didn't convince her. And then after that, she goes for weekly review to check whether anything is wrong. She feels like she's losing weight. Similarly, how similar to how her friend lost weight before, the cancer got to her, right? So these are the features that you're trying to understand. So a couple of things, and then, ask about any of this around. When it comes to a psychiatric illness, always ask about, what do others around you feel? Because you're trying to understand, is this just with her, or is anybody else in the family also feeling like, she's kind of having an overreaction? Right. So that's also something. Who else lives with you? Yeah, are they supportive? Are they also worried about your condition? Just understand that, family background. So most of the times they'll also say that, no, my husband doesn't realize how serious this is. He doesn't understand anything or something like that. So those are all your clues that, it's not a fabrication, but this is something that is in her mind, right? So it's not a physical symptom. So a couple of things that you guys have to, and hypochondriac disease. All right, that is actually a good question. So hypochondriac and somatization disorder. So in somatization disorder, there is actually, some, somatic symptoms that you will actually get. Like, she feeling like she's scratching, that rash, she actually has some somatic manifestation. In hypochondriacs, they actually get a whole lot of tests done, and most of the times it's negative. There is no somatic, sensation that is disturbed. Like any sensation, like you might be having some tingling sensations, you will feel like, your hand is burning up. They will have some somatic, symptoms that they will actually be trying to tell you. While in the other one, in hypochondriac, they just have a disease, and they'll just tell you that, I have this, I want to test for this, and mostly, the somatic symptoms that you're actually looking for, they might not be there. More than this, there's another one called conversion disorder. That's like a very severe form of somatic system symptom disorder, where you actually have like complete, shutdown of that neural pathway, where maybe after an incident or an accident, some people can just go blind, right? So in that case, is hypochondriac same as health anxiety? Health anxiety is something, it's not really, I don't know, it's an umbrella term. I can't really, a lot of people have been asking me this health anxiety. Like, I feel it doesn't really point to anything. So these are identified, DSM, what will say, classified, ICD classified terms. So it'll be better if you actually have diagnoses which are kind of, more known amongst the medical community to be a specific diagnosis. If you can't understand what it is, then you can always give an umbrella term. Like, this is something that, you might be worried about your health, it might be an anxiety related to health. If you can't really understand which exact symptom it is. Dr. Ashi is also asking about Munchausen. Oh my God, this is going to be a class today. So, Munchausen is, they actually like to get tested. They kind of, like to get that attention from, the. So that's basically, they will have a history of somebody in their family being very sick. And so, they like the attention somebody like that situation gets. And they would also put themselves in that situation. So they actually have insight. That's the main thing. They are actually do have insight, but they are very good at knowing the symptoms. because she has crash demand, looks like rash. Yeah, I mean, yeah, it could be. It could be Munchausen's as well, you know, because over here she's actually. How would you differentiate between somatization disorder and Munchausen? Because she is physically coming with an issue, right? Over there in Munchausen's, it will be way. Actually, it's very difficult to differentiate between all of them. It's actually because you don't have any physical tests to differentiate, first of all. So, you know, knowing what they are could help you, right? And with the symptoms that you feel are strongly suggestive of a disease, use that for making the diagnosis. So, if you were coming with the fact that this could be Munchausen's, you know, understand the different kinds of tests she's gotten over time, understand her background history, like you know, who was it that was sick, like what were the symptoms that way they were diagnosed with, what were the tests that they've undergone, understand that it was the same kind of test, you know, that they have undergone, then it will be a little bit more. So in somatization, there is no insight. Yes, somatization disorder, there is no insight. They are very convinced of the fact that they are mainly, you know, they have, you know, underlying issue that is going. Yes, Dr. Ranmali, you have something to say? Go ahead.
Yeah, I remember that in Munchausen, they try to like fake the test sometimes, like they don't have real symptoms, but they like I have blood in my urine, and they just bring a sample that's not there, something like that. They do things like that. Is that correct? That's what I remember.
Yeah, they're actually looking for medical attention. So they have insight in this case. And in fact, there is another version of this case where, you know, it's called malingering, where they actually have a monetary gain that they actually get. You know, maybe they may get some health insurance, so they'll try to fake it, right? So that's with an intent. This is just because they enjoy getting the medical, you know, issues. Usually seen in prisoners, yes. Yeah, Doctor. She's mentioning that. Yeah, that is usually seen in prisoners. All right. So let's just quickly go through the checklist. Dr. Anote, were you able to mark?
Yes, I did, Doc.
All right, and then we'll come to how to actually break the diagnosis to such, you know, issues. All right. All right, let's quickly take a look at this. Confirm identifiers, that was good. Acknowledge and confirm the reason for visit. Ask about the onset, characteristic of rash. Clarify associated symptoms. Explore malignancy-related red flags. Screen for psychiatric symptoms related to health anxiety, which is screen for somatic symptom disorder traits by asking if the patient frequently checks symptoms or seeks assurance. PMARTOSA, past medical history, medication allergy, family history, you know. Do general physical examination vitals and examine the rash. Ask about triggers, you know, the cancer fear, specifically discuss the emotional impact of, you know, friend's recent cancer-related death. Discuss any previous medical evaluation or test, explore patient's ideas, and then inquire about any previous episodes. I think this was actually done where she was like, have you had this before? You mentioned that this was happening again. So what do you mean by that? What was the thing that happened? Right? Explore the patient's understanding and concerns about cancer. That's again a good question. Like, why do you feel that you have cancer, right? And at one point, she feels like the lipoma is cancerous. Now she feels that, you know, the neck rash is basically cancerous. Like, what are the, you know, symptoms you're experiencing to call it cancer, right? Identify potential triggers such as recent bereavement.
Excuse
All
me,
right.
can I disturb you for a minute? The ICE questions, in this case, the patient has been telling all the ideas, concerns, and expectations. So do we have to ask them again, like she's concerned that it's a cancer and she wants further like tests and all that. She said it herself. So do I have to repeat and ask what do you think you are having? I mean, it sounds a little I don't know. I'm sorry. What do you think? I just want to know.
Repetitive, it feels like, you know, you haven't heard her. Exactly, that's absolutely correct. You know, ICE questions are a way of framing the questions that you've already gotten answers to. So if you've already gotten those answers, there's no point in asking ice all over again, because she's
Sometimes
actually,
they might get really annoyed if I ask what's your main worry, because she has already said that, isn't it?
because she's already mentioned that. That's true, because that's what most of the time. Actually, Dr. Mishi was very lenient with giving out the information. Most of the time, they won't tell you much. They'll give you just one-line answers. So you are supposed to get the answers out of them. So this is one of a good tool to actually make them express themselves. You know, like usually they'll be like, I'm just worried I have cancer. Last time also they did this. And then you'll be like, what did they do? Then they just did a few tests and they found out that it's not cancer, but I'm sure it's not. It is. Like, okay, what was the test? Where was it done? And then you can, so they just sometimes give you just one-line answer. So it's a good practice to, for if a person is not opening up that well, to actually use ice for them to express themselves. Do you understand? Because in this case, there was really no need, because it would just be a repetitive question, right? Because if you already have the answers of the ice, then, it makes no sense to keep repeating those questions, right? So explain the diagnosis, provide detailed explanation on somatic symptom disorder, refer for CBT, consider psychiatric referral if symptoms are worse, discuss medication if coexisting, the anxiety or depression, provide self-help resources and leaflets on somatic symptom disorder, reinforce lifestyle advice on stress reduction, healthy sleeping, sleep hygiene, and physical activities, arrange a follow-up 2 to 3 weeks to assess progress, and safety net, advice on what to do if symptoms change, arrange the patient, reassure the patient about absence of cancer. Yeah. Yeah, I think you were trying to do that, but it was all very jumbled. Everything came out together. I mean, you wanted to give the diagnosis earlier on, and then you wanted to say that everything that has been done is come out to be normal, and you really don't have cancer. But let's look at a little structure to that. Address repeated concerns about cancer. All right. Yeah. Yeah, I mean, yeah, this is a little difficult case, because no matter what you say, they won't agree to you, because they're always like, no, you don't understand. I have this, you really don't understand. Feel it, So they really don't have any insight. That's also something that we can actually mention as a part of the diagnosis. That can you offer SSRIs if at all you feel that the patient is depressed? In the GP, you can offer SSRIs, yes. But in this case, you might have to give SSRIs, you might have to give anxiolytics, right? You need to understand her sleep pattern. Is this actually how much is it affecting her life? It would be a better thing to actually refer them, so that any medication management can be done by the specialist, right? Because this is a little complicated of a case, so you don't want to really take that on, right? So if you can, and if you have found symptoms that indicate depression, and it's affecting their daily life, you asked about the mood, you asked about anhedonia, but then it was kind of on the edge, right? So, to actually make a proper diagnosis, you could always refer them to the psychiatrist for them to start this. Right. Mainly, it's if you're not sure on what to do, that's the best thing. The specialist will take a call on that. Right. All right, let's just quickly just look at the part how you could explain this. From what you told me in exam, it appears that you have, it appears that this is, I'm sorry, this is a typo. It's supposed to be not. However, this way, this concern is, the way this concern is affecting you sounds like something called somatic symptom disorder, So this is a typo, guys. I will change this. It says this is not cancer. However, give it the name, give it the entity name, and then move on to explain what the entity is, right? So the first thing you're doing is you're reassuring that what you're saying does not really, correlate with cancer. However, it kind of does sound like something that you might have. It's called somatic symptom disorder. And then you can go on to explain why you feel that. Initially, you were going on to explain why you felt that. and it came out like you didn't know how to express yourself. So, this would be a great way to actually start. This is a condition where someone experiences real physical symptoms like pain, rash, or fatigue, but the level of worry and distress about these symptoms become disproportionate to what doctors can find. Yeah, doesn't mean you're imagining things. The physical symptoms are real, but the brain is amplifying them, especially when it's under stress or grief. It's common after a friend or relative has gone through a serious illness. The good news is that it is treatable. With the right psychological support, the physical symptoms often tend to improve. So that's one way, you can actually, express yourself when it comes to this. And then you can go on to giving the management, according to what all issues that you find. Yeah. So I will be changing this where it says it's cancer. It's actually not cancer. All right, guys. So that was somatic symptom disorder. I knew this would end up in a big discussion. And thank you, Dr. Ashish. You definitely do know how to keep me on my toes. So we have Dr. Jur with us. So she is one of the doctors who's used our platform and has recently cleared PLAB too. So I'd invite Dr. Jur to actually share a few words with us and her experience in PLAB, and any tips that she might have to share with us. Dr. Jur. All right.
Hi, hi, Doctor. So just so I can introduce myself to everyone. My name is Flora, and I am a British citizen, but I did my secondary education here, but I did my university in Khartoum in Sudan, and I came back to the UK after I finished studying. So my main study method for PLAB 2 was I used an academy, I used YouTube videos, and I also used the TuringMedSchool application. So the way I used the TuringMedSchool is that I would study a case from All Days or from GK Notes by Dr. Levan, and I'll go on the website and I would find that specific case. So what I'll do is I would go through the case, and once I'd finished, I'd look at the feedback. So as you know, in PLAB 2, you've got interpersonal skills, data gathering, and management. So because I'm British, I do have the advantage of having natural IPS skills, but my weakness, I would have said, is more in management and data gathering. So what I'll do is once I've done a case, like for example meningitis, I would see my feedback. So anything that I wasn't too sure of or anything that I missed, I would write it down in a notebook. And obviously if I saw that case again, I wouldn't forget it. So that was the main way of practice really. So I'd just go through the cases daily. Sometimes I'd pick a random case, or sometimes I'd pick a case I want to do and see what I missed inside it. So I did that up until the day of the exam, and most of the stations which I'd practiced on this website, they did come up. And the stations I hadn't practiced, I just used the same structure that I learned. And yeah, I managed to pass with 12 stations out of 16. So yeah, that's my story. Don't know if anyone has any questions or anything they want to ask.
Dr. Joe, thank you so much for sharing. And that's some expert advice, guys. Everyone who's actually preparing, do follow a structure and make sure you are practicing, put your knowledge to a test to understand exactly how to get it out into words. So, Dr. Joe, do you have any special tips that you'd like to share, or anything that you learned from your experience giving PLAB too?
Yeah, so what I would say is obviously thank you to you and the other doctors who did the platform. I found it very useful. And something that I think is important is to have confidence. So even if on the exam you find a case that you're not completely sure about, just try to obviously it's hard. You have an examiner looking at you, you have the patient looking at you, but try to just remember, okay, what is the station? Is it a breaking bad news station? Is it a teaching station? And try to follow the structure, try to follow the red flags. So even at the end, if you don't completely get the right diagnosis, at least you've gathered marks for data gathering and for IPS as well. And another thing I'd say probably is to practice regularly, because reading notes is useful, but it's not the same as being in an exam situation and talking to a patient. So you have to have that experience of either practicing with your colleagues, your friends, or doing practice like this. And then it means that when you get to the exam on the day, it'll be just like another practice session. And I'd also like to say as well, whether or not you're in an academy, I really recommend you do mocks. So I did my mocks 2 weeks before my exam. So I did one on the 28th of April, and then I did another one on the 1st of May. And I feel like mocks are what is actually going to help you to actually know what the exam situation is like. Because I feel like if you don't do a mock and you just enter the exam, you're going to be you'll be quite overwhelmed. So that is one recommendation I have. And also it's important to look at the NICE guidelines as well, because this is like the exact management that is used in the UK management. And if you don't have access to it, you can use the NHS website, you can use Patient Info, you can use Google. So I think the most important thing is probably just to make sure you really manage your management very well. And yeah, that's my tips, I would say.
All right. Awesome, guys. Well, thanks a lot, Dr. Jur, for actually joining us. To stay for the rest of the session, but it does tend to go a little long. And you know, do reach out to us if you need any help with the registration process or you know, any other further help. We'll try to give you as much as resources as we can.
Yeah, thank you so much for allowing me to speak today. And I'll stay for like maybe half an hour because I've got like some other things, but I'll stay and watch for half an hour. And to everyone that's not done the exam, you can all do it. Just on the day, it's just very important to have self-belief, because when you show that you're confident, that does also get you marks. So yeah, thank you, everyone.
Awesome. Thank you so much.